All right. Good morning, Carol Johnson. Good morning, Brother Mark McPhee.
Good morning, Brother Bob Ponce and Brother McPhee. Mark McPhee, how
Good
are you?
morning, everyone.
So, this is your Wednesday morning COVID update. I don't know. I lost count of how many shows. I think we're up to somewhere in the 60s or 70s in terms of how many shows we've done. Um, we're glad to have Carol Johnson back with us. She had the day off last week, but she's back in action, and we got some things to talk about.
Oh, yeah.
So, there have been some reports that um, New York City is talking about um, limiting for restaurants and gyms only admission to people who are vaccinated. This, to me, this is an unconfirmed report for a couple of reasons. Number one, I have looked on the mayor's office website and they are not saying anything about it. I've not seen an executive order. And number two, well, that's number one and number two. So the interesting thing, as we know about the politics of this thing, and we've seen it over the course of this pandemic, is that many times Mayor de Blasio will make a statement and it gets countermanded by the Governor Cuomo. Now, we're in a situation in this point in time where Governor Cuomo has other things that he has to deal with. So I don't know if he's going to countermand this or not, but I am going to say we're reporting that there is movement in that direction, but until I see it officially on a New York City website, I am not, I don't think we need to report it yet as news. But here's the most important thing that we can convey to you who are listening. There's been a lot of confusion around a lot of the announcements around COVID-19, whether to wear masks, what are the vaccine protocols. The confusion should not be an excuse for you protecting yourself. You cannot use somebody else's confusion as a reason not to take care of your own health. And that is the only mission that we have, is making sure you get good, proper information about what's going on.
I definitely agree. According to CBS News, this is what they reported. But as you said, it has not been mandated and nor has it been confirmed. But once again, it's always best that we follow the protocols and that we remain vigilant against this virus, because from according to the information, we have Texas and Florida last week have tremendous new cases of the virus, and Louisiana happens to be the number one state where the COVID um, virus is really doing damage. And so we have to err on the side of safety and precaution.
Right. So if you take a look at the map on the screen, the good news is that you see up here where New York is, you know, by comparison, we are very, very low with the rest of the country. That doesn't mean we let up. It means we keep our, foot on the gas pedal until we get out of this thing. But the good news for us is that we don't look like it looks like down south. If you look at Louisiana right now, is just, it looks like a kill zone. And Florida, as you can see, Alabama, Mississippi, Texas, Arkansas, you see a lot of the dark spots are bad. And you see it also over there in Alaska. And you see another dark spot up there in like Seattle, Washington area. So the good news is that we're doing the right things, and that's why our numbers have been going down. But it does not mean that this is the time to celebrate and do victory laps this battle is not over, and we need to stay vigilant. And so, again, you know, we recognize that a lot of the information that's coming out is confusion. First, they say, "Hey, you don't need to wear a mask if you're vaccinated." Then they say you do need to wear a mask if you're vaccinated, and then you're saying now you can't go to the restaurant if you're vaccinated. So we know this stuff is frustrating, but this is why we come here every week to give you information that's been critically filtered, and so that you can make the right decisions to protect yourself and your family.
What's a little frightening is that that map looks very much like the maps that we were showing in like April, early
Mm-hmm.
April. It's just that the states were reversed, but
Mm-hmm.
that's the way it looked. But at that time, it was in California
Mm-hmm.
and in South Dakota, North Dakota.
Mm-hmm.
So it was on the on the western side of the country, and then it quickly just sort of did lapse across to New York.
Mm-hmm.
So when you see these numbers are starting to rise, and you also see that those dark spots down on the eastern seaboard, a lot of
Mm-hmm.
those people are going back and forth
Mm-hmm.
to New York.
Yep.
Yeah.
And so the information that we seek to inform and educate people is so important. I'll give you example. I was speaking to my sister 2 days ago, and she tell me that my nephew and his girlfriend were planning to go to Miami. And I say, sister, Miami, Florida is not a place that anyone should want to go because Florida happens to be one of the hot spots. And so
Mm-hmm.
my other sister also told my sister, tell your son that he should not be traveling to anywhere near the South at this particular point in time. We have elders in our family, and I just have a nephew who passed away on Saturday. He had massive heart attack. But my point being is that we have to remain, once again, I come to ring the alarm, not to scare you, but make you be aware of trends that are taking place. And if I know that Florida is a hot spot for COVID, then that's not going to be one of the places that I'm going to wish to travel unless it's totally necessary, such as a funeral or some other type of business that, requires for me to be. But just to say I'm taking a vacation, to the sunny state, no.
I want to also give some other information. This just kind of came in on my phone, that they are looking for students aged 12 to 17 to try to get their first vaccine dose by August 9th in order to be fully vaccinated before the school starts. So that's only a few days away. That's only 5 days away. So if you are dealing with kids in that 12 to 17 bracket, it's something you should be looking at trying to get that done as soon as possible. I think some of the reasoning behind that is that the vaccination for COVID also interrupts some of the other school vaccination protocols. So they're trying to get them done early enough because you can't really have the COVID vaccination and other vaccinations at the same time. So in any case, people who have kids in the 12 to 17 range and are looking to get that vaccination should try to take care of that as soon as possible.
Well, guys, I'm sorry, but I have to sign off. But I'm glad I got in here for a little while with you. And
Absolutely.
I will talk
Absolutely.
with you guys later.
Absolutely.
Okay. All
Bye
right.
Okay.
bye.
That is Carol Johnson.
Stay safe, everyone.
Okay. All right. So Mark, we will hold it down without her. The other thing I want to talk about is, you know, there's a report that COVID is spreading like wildfire in ICE facilities, and this is something that the U.S. Immigration and Customs Enforcement is reporting higher than ever rates of COVID-19 amongst people in its custody. Since February, the COVID-19 positivity rate has doubled. So we got, a kind of a whole new outbreak, in ICE facilities. So, this just kind of underscores what we've been saying is that, even as we see the numbers go down, people start to let up and then the numbers go back up again. This pandemic is very, very tricky with all of the variants that are coming out. The directions can change very quickly. So it's why we have continued to recommend all of the protocols, and so everything that we were doing before the vaccination process started, which was social distancing, washing your hands, using a mask, doing things personally to boost your immune system. All these things are still in play, and they're even more important now with the Delta variant, which is spreading so much more quickly than the original version. That we lost so many of our friends and loved ones from the original version, and the version now. The other good news that is happening though is that even as it's spreading, it looks like they are having much less hospitalization and much less deaths as a result of COVID. And I think it's from a combination of factors. I think that the doctors have learned more about how to deal with it. I think the vaccinations certainly have helped, because even when you're having people who have been vaccinated who do get COVID, they are not getting it as severely as people who are unvaccinated.
Many years ago, I was part of the Coalition for Parole Restoration. And one of the things we did is that we were part of the Prisoners' Rights Division of the Legal Aid Society. The attorney who started the organization, she was an attorney for the legal aid. And a year and a half ago, her as well as some of my colleagues have come out of retirement to address the issues of our state prison facilities, because as we know, it's nearly impossible to social distance in prison. And we saw a number of people pass away in prison, but also on the good side, we saw some compassionate releases where those who were at most risk for the COVID virus that had less time on their prison record was released last year as per the Governor Como. But we still have to monitor those facilities. And I'm surprised that NICE freely, gave this information, because with any of our prison facilities, a lot of that information goes under the radar.
Mm-hmm. And that's such an important thing that we have to continue to keep our eyes on, because we have to get through this with everybody, and this is not the time to start to ignore people who are in facilities of any kind, whether they be prison facilities, whether they be senior facilities, nursing homes, whether they be ICE facilities. All of these types of facilities have had tremendous COVID problems, and there have been issues in terms of cover-ups and faulty data. And so, in many of these situations, it's even worse than we have heard because of the reporting on it. And so, you know, while all of us want to, you know, be able to step through this and say, hey, the pandemic is over, but the pandemic's not over until it's over for everybody. And, whether you like that or not, whether you believe that or not, as long as it's is brewing somewhere, it's got the attention to come back anywhere. And in particular, because we're here in New York City, which is a social hub for the entire world, not just the country, but the world. In other words, everybody comes here at some point in time. Somebody from everywhere comes here. So somebody from Miami is going to come here. Somebody from Louisiana is going to come here. And if they get on a plane and come here and bring it here, then we have it back. It comes back that quickly. And so that's why we have to continue to remain vigilant until this thing is really eradicated.
And one of the things that we do at the Harlem Emergency Network is that we dispense information. And the choice to get vaccinated or not is solely up to you. But as we have done in the past, giving you a listing of places to get tested for COVID, I'm not sure, Bob, do we have a list for those who may be interested in getting the vaccine that we can relay to the public at this time?
I think there's a number we can call, or the city. Let me look that up. We've had the list and the numbers have changed, but the city websites or the vaccine hotline, you can call this number 646-838-0319. Business hours, and they can give you information on where to get vaccinated. It's easier than ever. There are more places. There are more incentives to get vaccinated. I know that there are places that are actually giving out cash bonuses for vaccination. Let me see if I can find some of that information and share that.
Homebound, they even have a program where they will come to you. So
Right.
as my colleague says, it's easier than ever. A lot of places there are no lines and you don't have to pre-sign up. You're able to walk in and request services and get it on the spot.
Mm-hmm.
And from some of the TV ads and radio ads that I've heard, because I live in I live in an area that is populated by folks from outside of the country. They will not ask you your legal, status. They will not ask you, to show that you are an American citizen, but they will ask, questions related directly to COVID and not to your citizenship.
Mm-hmm. So I do have a website I'm gonna put up on the screen in just a second, where people can not only find out where to go, but they can also check out the incentives. As I said, if you've been hesitant and need a quick $100 you get on a prepaid debit card, why not go ahead and do that? And again, we understand that, making these things are a personal decision, and we think that people should make that decision in conjunction with discussions with their own physicians, not with Twitter physicians and Facebook physicians, but actual doctors. Those should be the people who you're talking to your health about. But okay, this website, vaxfornyc.nyc/incentives, and you can find out about not only where to get vaccinated, but also to be able to get a $100 prepaid debit card for getting vaccinated. So, um, you might want to check that out.
And
Um,
one of the things that I've been saying for the past year and a half is to keep your immune system up. I've listened to Carol and Bob week after week remind the listening public that you have to keep your immune system up. That means taking your vitamin C, that means taking vitamin D, that means getting some of these nutrients if you cannot afford or pay for them, get it from food sources. That's another great way to make sure that you're getting the nutrients. And while we have the sunshine of the summer, get outside. I was one because of health disparities. I was cooped up in the house. And my doctors say, Mr. McPhee, when the weather is nice, there's nothing wrong with you going outside and getting some sunshine on your face. And so that's the message that I lead to you. And I want to credit the Harlem Emergency Network for helping to save my life in the middle of the pandemic when the hospitals was full because of our communication systems. I was able to communicate to my brothers and sisters in the HEN network via our communications so that they know what was happening with me. And by the grace of God, the ambulance came on 3 separate occasions for me. I did suffer a stroke, but the point is, I was able to communicate. And so we've been hosting community preparedness long before the pandemic, where we asked the houses of worship to allow us to come in and share some good practices with your congregation. Because the sad thing is that many of us don't have batteries, let alone a flashlight. And we saw that in the midst of this COVID pandemic, the 99-cent store where you were able to get, hand sanitizer for 99 cents was now $5. Lysol products were now $12 and $15. So price gouging did take place. And so our motto is like the Boy Scouts, be prepared. And if you are ready, you don't have to get ready. Thank you so much.
yeah, those are the words of wisdom. Listen to what he's saying. It's important information. Um, I want to reiterate what you were saying about your immune system and watching what you eat, getting the sun. The sun, the reason why we say the sun is because you get vitamin D directly from being in the sun. And vitamin D is one of the most important and critical resources for your body immune system. It actually, vitamin D controls over 1,000 different systems within the body, all related to immune system. And so your best way to get it is actually to make it directly. Your body makes vitamin D from sunlight. So it's one of the reasons why, if you remember last year, we had a tailing off of the virus in the summertime, and then it picked up in the fall, because as we get into the winter months and we have less sunlight and people are out less, they become more susceptible. And so during the summer, you want to get lots of sun. In the wintertime, you want to take vitamin D supplements, especially people of color, people with melanin. Melanin is a great protector, but it also makes it more, as it protects us from the rays of the sun, because people without melanin are more susceptible to skin cancer and those sorts of things. So melanin protects us from that, but that protection also makes it a little bit more difficult to absorb the vitamin D. And so we want to supplement that. If you don't have a chance to get outside, you should be taking vitamin D regularly. You should be taking vitamin C regularly and preferably from food sources such as fruits and vegetables. You should be getting zinc in your system also something you can get in food sources such as fish and seafood. And so these are things that you need to start to do more research on your own on how you can boost your immune system. We're probably going to come back and do another episode where we dive deeply into it, because we feel like this is the information that's been underreported. That we already know from the history of this pandemic that the people who got hit most were the people whose systems were compromised by what they call comorbidities, and that means the things that generate diabetes and heart disease. A lot of the same factors pop up in all the health challenges that we've had in our community. And that was the biggest thing that we've learned from COVID was, we lost so many of our family and friends, and a lot of it was due to just poor health care in general. And so, it's taken, COVID was like an x-ray for the whole country where we got a chance to see everything that was wrong politically, medically, systematically. And so we have to address those things. This is, hey, guess who's back? Carol Johnson's back. Okay, I think she was back. So we have to address these things together. You know, we have to.
Yes, I'm back. I should be able to be here for the duration of the show.
Okay, so we were
Um,
just talking about,
One of those things,
you
you have to
know,
take care of yourself. We talk about protecting ourselves and taking care of
right.
ourselves, and that's what I'm
Mm-hmm.
doing now
Mm-hmm.
at the hospital, having some tests done, very needed tests.
Mm-hmm.
So that's why I'm in and out today. But it's all part of what we've been talking about. Maintain your physical, your mental health. It is so important in times like these. Period.
Mm-hmm.
Period.
Mm-hmm.
But especially times like these.
Yeah. So the mindset and what we talked about, what Mark talked about, is that we get through this together. We support each other. Share real information with people. This is why we we're up every Wednesday morning. We're here live on Facebook and YouTube to get this information out there, because we need to share real information and sort it out. We know that people are confused. Can you hear us, Carol? Carol?
And so I'm at the hospital at least 3 times a week for therapy and other health issues. And so I want to pre-warn the public that if you have any type of health ailments, now is the time to address your doctors and address the medical system, because you don't want to wait until, God forbid, the hospitals get filled up again, and now you have fear of going in the hospital, because that's what kept me out the hospital, fear of the contagion in the hospital. So now is the time to get those minor medical procedures taken care of. Make sure that you have a health proxy. Make sure that you have documents in place so that when things get shut down, you don't have to worry about trying to go to the Department of Health or trying to get a Social Security card and other important documentations that you may need. The time to get those things is now, and not waiting for a possible shutdown or a reduction in services. So that is my, you know, that is my contribution to this broadcast this morning as a person who has gone through it and a person who is still going through it and a person whose life have been greatly appreciated by my brothers and sisters in HEN and the information that I taught. And one of the stories that I can tell you is March of 2020. I show up at a family birthday at Red Lobster with my mask and my gloves. And my family said, "Boy, take that mask off your face. What you doing with gloves on?" But a few days later, the whole country was wearing masks and gloves. And so I credit that once again to the information that was shared between us and with us at the Harlem Emergency Network. We've been doing this work for quite some time. And so our focus has always been community preparedness and making sure that you know what to do in the case of a crisis, whether it be a pandemic such as this, hurricanes, or any other, act of nature where you find yourself having to basically fend for yourself. So we teach some survival skills. And Miss Carol Johnson and Bob Ponce are treasures in our communities that should be appreciated. Thank you.
So I think that's all we have to talk about today. To wrap up, New York City is making some noise about limiting access to restaurants and gyms to people who are vaccinated. This is unconfirmed at this point in time. There's talk about it, but we want to wait and see until we see something official from the mayor and or the governor about it. But it's important for you to understand that things are moving in that direction. There for city workers, for municipal workers, they are definitely New York City is requiring all municipal workers to either get the vaccine by September 13th or they're going to need to be tested weekly for COVID. So that's happening. And we're seeing more and more push for private. They're pushing for private businesses to also have mandates for vaccination. So this is something that is probably going to continue to rise until we see a decrease in the Delta variant and the spread of COVID. So again, we're just spreading that information for you to make your decisions accordingly. But this is where we are. We've mentioned that if you have kids aged 12 to 17, they are recommending you try to have your kids vaccinated by August 9th, which is only 5 days away. So you might want to look into that as soon as possible. And finally, again, protect yourself. Do not let the confusion of all this information and changing in direction is not an excuse for you to not protect yourself and protect your own health. You can be mad at the mayor, the governor, the Department of Health, the CDC, and everybody else because they said this day, and then they came back and changed their mind because they got new information. That's how it goes in a health crisis. You have to make new decisions based on new information. So you should not use that as an excuse to not make the best decisions for your own health. And that's all we've got to say about this morning.
But just one more thing, if I could say one more thing. The moratorium for evictions has been extended. It originally expired July 31st, but it has been extended till October 3rd. So I suggest whether you're in the situation, possibly a situation with being evicted, or someone, a family member in particular, your elderly relatives, check with them, help them fight, go to your elected officials, but it has been extended into October 3rd, and they are trying to extend it beyond that. But right now, you got to do it now. You know, if you haven't made any attempts, you've got to do it now.
Okay, there it is. And so you see on the screen that website, vax4nyc.nyc/incentives. You can go there. You can not only find out where you can get vaccinated, you can actually get an incentive, which is $100 prepaid debit card. So that's what's on the table right now. If that's something that can motivate you to get it done, then go ahead and pick that up and get it done. So on behalf of the Harlem Emergency Network, we thank you for listening. Please like and share this information, pass it on, and look out for yourself and each other.
Thank you. And as always, stay safe, follow the protocols, and have a great summer. Carefully but fearlessly.
All right.